Alright guys, well today we're going to be talking about a couple different types of dressing changes, including clean and sterile and the differences between each one. So we're going to start with the clean dressing change and show you guys how to do that. So why don't we get started? Well, first when you walk in the room, obviously you're going to identify your patient. So, sir, can you state your name and your birthday? Alright, I'm going to say that was good. And ask him about his level of comfort. And just make sure he's comfortable before you get started with anything. Is there anything I can do to make you more comfortable, or are you feeling alright? Alright, he's feeling okay. And then we're going to go ahead and explain the procedure to him. And sir, as I've probably done this to you before, you do have a dressing, and we're just going to change that, clean it up, and try to help prevent any infection or anything along those lines to get you out of here a little bit faster. Is that alright? Okay, good. And then if you haven't already, you want to go ahead and gather all the supplies you're going to need to perform the dressing change. So we'll go ahead and do all that, and we'll get everything we need, and then we'll come back, and we'll go ahead and make sure he feels comfortable, and close the drapes around him, make sure he's separated from the other patients, and he has a little privacy. And then we're going to go ahead and wash our hands if you haven't already done that too. So wash my hands here. And we're going to toss on our gloves, and since this is clean, these just a clean dressing change, these don't have to be sterile gloves. So we can just grab a pair of clean gloves and put these on. So we're going to go ahead and put on our gloves. And then we're going to help the patient into the correct position. If they can do it on their own, obviously let them, but if they need some help, so go ahead and help them, and he's going to need some help. So we're going to go ahead and position him so that we can get to the dressing. I'll turn him on his side, and ask him to hold the side rail, position him over there. And again, you want to make sure you maintain patient privacy. So we'll do the best we can to cover that up and leave us enough room to do the dressing change. So the next step is to remove the dressing. So after you've performed your hand hygiene and reapplied your gloves, you're going to go ahead and take the dressing off. And you want to grab the periphery of the dressing and make sure you keep your fingers down on the patient's skin to prevent any skin tear as you pull the tape off. And you're going to pull it down and do the same thing at the bottom, making sure to do your best to prevent any skin tear. And then you're going to discard the dressing in the appropriate containers. You're going to actually remove your gloves. And again, wash your hands. So after you've performed your hand hygiene and applied a new set of gloves, you're going to go ahead and clean the wound. And you want to make sure you have a clean gauze for every wipe that you make. And you're going to put it in the appropriate solution, and then you're going to grab it and top to bottom and inside out. So you're just going to grab it and wipe away. And you're going to grab a new one and do the same thing. Top to bottom, inside out. Wipe away. Wipe away. And wipe away. And continue that until you have thoroughly cleaned the wound. And after you do that, you're going to apply a new set of gauze. Before you do that, if you'd like, you can grab dry gauze and just dry the excess water, because you want to prevent as much skin breakdown as possible. So after that, you grab a new gauze that you have prepared. You take it, tape it on, making sure the tape is away from the dressing and only the gauze is actually resting on the dressing. And tape it into place. And then after that, you can reposition the patient, make sure they're comfortable, and everything went well. Alright, well up to this point we've followed the same steps as before, which are to identify the patient, assess comfort, explain the procedure, gather supplies, make sure the patient has adequate privacy, and then perform hand hygiene and apply your gloves. So now we're going to use the same technique as before and remove the dressing. So we're going to grab just the periphery of the dressing, making sure you keep your fingers down and push on the skin to avoid skin tear. You're going to remove the dressing and perform the same at the bottom. And then discard of it in the appropriate container. Then you're going to remove your gloves and again perform your hand hygiene. And before you do anything else, after you perform your hand hygiene, you're going to prepare your sterile field. And then apply a set of sterile gloves, which I can do off camera. We've established that. Okay, so we're going to go ahead and apply our sterile gloves. And after we do that, we're going to fluff and moisten our sterile gauze to help clean the wound. And using the same technique as before, top to bottom, inside out, we're going to go ahead and clean it. So with one hand, you're going to wipe away and make sure you use a new gauze every single time. Using the same hand, and wipe away. And that follows all the way until you think the wound has been thoroughly cleaned. After you've done that, you're going to grab your sterile dressing, and with the other hand, apply that to the wound site. And then with that in place, you're going to go ahead and secure the dressing. And then you remove your gloves, perform your hand hygiene, and document everything you just did. Just like before and all the other dressing changes we've done, the first steps are pretty much the same. You want to identify the patient, assess for comfort, explain the procedure, gather your supplies, make sure the patient has adequate privacy, perform hand hygiene, and put on non-sterile gloves. Then you want to remove the dressing, assess the wound, and remove those gloves. Again, perform your hand hygiene, prepare your sterile field, and apply your sterile gloves. After you've done that, you're going to fluff and moisten your gauze pads to do the cleaning. So you're going to top to bottom, inside out, so just wipe, and then throw away the gauze, grab a new one, wipe, discard it, and again grab a new one, and repeat that process until you think the wound has been thoroughly cleaned. Now since this is a deeper wound, make sure you don't do too much to cause any damage to the underlying skin. And after you've done that, I'm going to grab the continuous packing material and moisten this as well. And after you've moistened it, you want to gently pack it into the wound, making sure not to cause any damage to the underlying tissue. So gently pack it into the wound. This is a large wound. And after it's been packed, grab a dry, sterile gauze, apply it to the outside, and I do have tape. Hold it in place while your friend grabs you tape. No, apply the gauze, hold it in place, and secure with tape. Okay, after you've secured it in place with tape, you want to initial and date the wound, the dressing. After you've done that, remove your gloves, document everything you did, and you're done. Alright, just to review the procedures we've been going over, the beginning steps for most of them are pretty much the same, and it's not until you get later on into the technique that specific steps come in dependent on the technique itself. But for the beginning steps, they're usually the same, starting with identifying the patient using the 2 patient identifiers, assessing for comfort and or for pain, and giving them anything necessary. And make sure you explain the procedure to them, what you're going to be doing. Gather your supplies so that you don't have to interrupt yourself in the middle of what you're doing. Ensure that they have the appropriate amount of privacy, draw their curtain and keep them as covered as possible. Perform your hand hygiene and applying your gloves. Remove the dressings and assessing the wound. Assessing the wound is very important, so when you go back and document it, you know exactly what to say. Remove your gloves after you've assessed the wound. Perform your hand hygiene. And then at this point is where the different techniques come in for the ordered dressing change. And other than that, you just want to make sure you initial and date the dressing after you're done, and then you have performed your different dressing changes. And yeah, that's it. I know I look beautiful having this camera stare at me. Hi Mom, Mrs. Fleck, we love you.